All right, so yeah, Bill came up to me a month ago or so and was he's had the pleasure of a couple of treatments from me in the past, and so yeah, I'm actually an ER doctor, but I went through a medical acupuncture training and have been practicing kind of as an adjunct to the ER for about 10 years. Had my private practice, and then now I just work at the VA. So can't hand out cards to you guys unless anyone's a vet here in terms of myself, but I'm happy to provide like referrals if anybody wants, or like I don't know if I can do that on the website, or you can come up to me. But anyways, I wasn't quite sure how best to approach this for you guys, but I'm not going to go through the whole mumbo jumbo about how acupuncture works or why it works, and it would take forever, and it was really not forever, but way longer than what we have. I'm an avid runner myself, and I'm very familiar with the aches and pains that come with distance running, speed running, etc. I'm also familiar with how these things are often kind of refractory to conventional treatments, especially meds. I'm a strong believer in PT and massage and chiropractic, and many times patients will try all of those and still feel like, is there something else out there? And so acupuncture is something that you can always keep in mind. From a how does it work perspective, just really briefly, like Western medicine, it's becoming very popular in the States, and universities have research programs going on. UVA, they use acupuncture in their surgical in surgery for anesthesia. I mean, it's there in prominent Western medicine now. And study-wise, we still don't know from the scientific perspective how it works. The theory, I guess the ongoing theory for Western thinking, Western-minded medical doctors is that the needles promote either blood flow to the area and or a response with endorphins and healing your own body's innate healing mechanisms. So the Chinese, where acupuncture has been practiced for thousands of years, the Chinese believe that the body is a system of energetic circuits, and injury or illness is basically a break or an interference in the flow of that chi or that energy through your what they call meridians, which are actually have been tested by little probes and energy probes, and they're legit. They travel along fascial lines. The points themselves have been found to have a little bit stronger energy frequency to them than regular tissue. So there's something, but that's the Eastern philosophy of why acupuncture works. And then the last thing, which I don't know much about, but the Japanese approach to acupuncture, which is much more superficial with the needles. They focus more on muscle tissue and tendons and trigger points. And top 3 reasons why people have not tried acupuncture. Anybody want to try a guess?
Scared of needles?
Huh?
Scared of needles?
Scared of needles, that's number 2. Or that's one of them.
Mumbo jumbo.
Or
It's like you just don't believe in it.
Yeah, it's not Western medicine.
Yeah, right. Yep. And the last one was insurance coverage. Exactly.
Wow, excellent.
Right on. 3 tries and you're off. So insurance coverage, that's becoming more and more. Insurance companies are definitely starting to cover it. Scared of it, I can say that acupuncture needles are much, much thinner than blood drawing or needles that you get your flu shot and such. They're not hollow. It shouldn't hurt. There's very few, if any, side effects. The biggest side effect would be to puncture a lung, but the way to avoid that is just not to go anywhere near the lung. And that's my approach. But in terms of introducing infections, never been shown to, or never been. It happens as when you cut yourself, but it just doesn't happen. They're just tiny, tiny little needles. And And then the fear of pain, I mean, it can hurt. If you hit a nerve, it can hurt, and there are nerves everywhere, so that's something that we can't avoid. But in general, patients will tell you, I mean, hopefully all of you know somebody that may have had a treatment, or it shouldn't hurt. You know, the needles go in, you may feel that chi, you may feel that energy flow, but generally, you know, unless we hit a nerve, it shouldn't hurt. I guess that's the last thing for the fear. So in terms of what you guys care about, which is whether it's going to be useful for some of those injuries, I'm the first one guilty of not being willing to stop running as a way to cure my injury. I don't know if anybody else can relate to that, but that's just a really bad idea. So we have to kind of work around that. And the good thing, I think, or one of the good things about acupuncture is that it really tries to address the underlying cause as opposed to doing the Band-Aid. I mean, I personally have used it for a couple of different things, and one of the important things to keep in mind if you do try it is that the longer that underlying cause has been an issue and your body has tried to sort of realign itself to overcome it, the longer it takes acupuncture to reverse that. So you may need 3 to 5 treatments or so, but if you have something that's only been brewing for a little while, 1 or 2 treatments can usually turn it around pretty effectively. So there were a few, I was like, okay, what do runners tend to get?
Hamstring.
Hamstring.
So the posterior cord, all the way up from your Achilles, up through your calf, through your hamstring, and even into your low back, that is really tight with runners. We're just like this, we're just doing that forward motion. Acupuncture is great to release all that tension, open up the not only the blood flow and the energy flow in those meridians, but also to pinpoint the muscle, where the muscles are tight, where the tendons are getting drawn on. Very helpful there. And then associated with that is, since you're so tight, you're kind of going like this, your pelvis loses its stability, and you get this lazy butt syndrome that you may have heard of. We're not firing our lateral gluteus, and then your hips sort of like this. And another thing, your brain, because you're not really strengthening those muscles, your brain connection is not fired. So by sticking some needles in there, believe it or not, that does sort of wake up the brain to the existence of these muscles, and it starts to generate that ability to start to line you up. Overtraining syndrome. You know, so if you get either you're an ultra runner and you just run all the time, or you're new to the sport and you're maybe going a little bit too fast and starting to tire out, you're not sleeping well, you may feel sore all over, it's hard to recover. That's all sort of part of this package of overtraining syndrome. And you're basically in an adrenergic overdrive. You know, your body, you're like craving this, and you're overly adrenaline stimulated. Let's see if I can get to my little points on that. Yeah, so it's your sympathetic system that's in overdrive, and your parasympathetic system, which is the one that sort of helps you relax and, you know, gets your GI tract back on and helps you sleep. That needs to be re-engaged, and acupuncture is fantastic with that. A lot of patients will leave the office just feeling so chill and relaxed, and that's the immediate effect, but it does have a prolonged effect in addition. So, kind of like a few different things that we can touch on. Treatments usually last anywhere between 30 and 45 minutes, depending on a number of things. And like I said earlier, acute injury, 1 or 2 treatments. Chronic, probably at least 2 to 3, you should know whether at least it's helping or not. But then and then what we aim to do is to stack treatments in the beginning, like maybe once a week. And then as you start to get better, you can make it every 2 weeks, every 4 weeks, and then eventually just taper off once your problem is gone. I guess that's pretty much it. I'm open to questions. I'm open to, any thoughts or suggestions.
I have 2 questions.
Sure.
The first one, what's the difference between acupuncture and dry needling?
Good, excellent question. And I don't have a great answer because I'm not super familiar with dry needling. I just know that it is more superficial.
Okay.
Everybody know what superficial means, like just more near the surface. And it's localized, whereas acupuncture generally is a more full body treatment and will, engage the energy meridians like I was talking about. So that's.
And my second question is, if we wanted to pursue acupuncture, do you have any suggestions for like what to look for in a practitioner?
Yeah,
how to
great
pick,
question.
like a quality one?
Definitely. So yeah, you do want to make sure that they are, certified, that they have, a legitimate degree. I would go with somebody who's been practicing for, a good 5 years or so, because so much of the learning happens through your clinical practice. But so for me, there's medical acupuncturists, and then there's licensed acupuncturists. Those are sort of 2 different things, because we go through a different program. And that's just trial and error, to be honest with you. I mean, a medical acupuncturist is a Western trained doctor who then learns these Eastern angles and techniques in that context. Whereas, like a licensed acupuncturist has gone to a Chinese medical training, school. If I were doing that, I'd probably want to go to somebody who's been to China.
Not recently.
Not recently.
Good point. Just from my conversation with people, but I haven't been myself by any means. And so the benefits of seeing someone like with my training background is just that I have the ability to say, I'm not sure that acupuncture is the right thing for you. Maybe this is a little bit more serious or different, whatever. Whereas, I think the benefit to going to somebody who's been through a Chinese program, through a program that's more traditional, would be that they may have a slightly or a deeper understanding of it.
That's great. Thank you.
Yeah.
Sonja,
Yeah.
I just wanted to mention that dry needling is done in muscle, in trigger points or tender spots in muscles.
Thank you, Dan.
That's
Yeah.
what we do. dry
So
needling.
that must be very similar to the Japanese style then of acupuncture.
Dan, do you practice dry needling?
I do dry needling, yes.
Okay, so that's how you know. Okay,
Mhm.
that's excellent. Thank you. I did not know that. That's good.
Sonia, can people use acupuncture for like wellness? I mean,
Oh yeah.
We tend to want to go to it when we have an injury,
Right.
but like on a regular basis.
Yeah, great question. A lot of people use it just as maintenance, just to keep themselves feeling good. And in my reading for this, actually, I learned that Dina Castor is a big acupuncture proponent and has treatments on a regular basis, which surprised me. But yeah, absolutely, very much so. That it? Everyone ready to go home and take a warm shower?
No.
Thank
Thank you so much.
I have needles with me if you wanted to see just how tiny they are.
Well,
All right, so this is like a needle that we would put in your ear.
Whoa,
Let me use
it almost
That looks kind of big.
can't
Oh,
see
no,
it.
wait a minute. It looks like a hair.
It's a hair, yeah.
Oh my God.
They are very fine.
So super,
Oh
super
my
fine.
I have a lot of needles.
It's like a
in my-
splinter.
Yeah, it looks like
less
a
splinter.
less than a splinter.
By comparison, and
Oh,
these
God.
are, I mean, so this I would put in, you know, deeper into the muscle. That could go in your back, it could go in your leg.
With this.
But the,
Oh my God! Ow! Ow! I'm getting
look how thin
chills. I'm
that
getting
is.
chills. I'm getting chills.
It's a little more substantial.
Don't.
but
All right.
still, it's thin.
Blindfold me. Blindfold me.
What depth are you looking at?
so it varies.
Okay.
I mean, it could be 2 millimeters,
Right.
just as much so it's standing, to completely in. This
That
whole,
could go
Wow.
whole
through.
thing.
That could go through parts. of
So if I were putting this into your paraspinal muscles, I would be, I mean, you guys are all thin, so I'd probably be in about,
I don't know about
about
that.
a, you
Some
know,
are
2
thinner than others.
centimeters or so.
You know.
But a big guy,
That would
you know,
pierce. That would have to pierce a lot
I'd
of
have to get a
fat.
longer needle.
What is this?
Dang! Ow!
Are we wiggling it around once we're in there?
Is that the longest?
No, not at all.
Oh my God!
But I mean, like I said, like someone like you, I'd never need anything longer than this. But
See, I thought it was all very much.
a chunky guy.
I thought it was very, like, very
So-
small.
Hefty needles.
I never knew it was that.
Pete,
Yeah,
is this what you do at the VA, or do you do other medicine?
You do-
I do the ER every day except Fridays. Fridays is my acupuncture day at the VA.
Oh, okay.
So then I treat mostly chronic pain, a lot of back pain,
Yeah.
some peripheral neuropathy, stuff like that.
Okay.
But yeah, just at the VA now.
Yeah.
It's a great place to work.
Yeah.
The patients are super. I miss my private practice a little bit, but you know, pros and cons.
Yeah. It's August. Yeah.
Any other questions?
It really was. You put it in there, you leave it in there.
Oh, well, yeah, you leave it in. So your treatment, you know, usually leave it in like 15, 20 minutes, depending on what you're trying to do. So, you know, some things you just put it in, you get the muscle grab or whatever it is, the release, and then you pull it right back out.
Okay.